Hello everyone. So today we are doing this Insta live session with Ms. Sumaya Dalmia. She's a fitness expert and she has her range of gyms and wellness spas, gyms particularly into fitness, running across the country. She's a authority in her field, and today we thought that we'll discuss uh, what makes cosmetic surgery and fitness go hand in hand. So I'm accepting her request. Joining us soon. Hi everyone. Hi. Looking forward for this interactive session, which should be fun. I hope she does not fight with me. Hi, Miss Maya. How are you?
Very well,
Good,
very well.
good,
How are
good.
you? Finally,
I'm good. I'm good.
finally.
Lovely to see you.
Lovely to see you.
Yeah.
I've
So,
actually been, I saw you on a live with one of the skin specialists that I follow.
hmm,
And for the first time, I thought that, we have a plastic surgeon in the country who's pretty international in his outlook. And I've actually been meaning to do it. It's funny that you asked me to do a live, but I've actually been meaning to do a live with you for a while now, just to, talk about how the fitness industry is, how aesthetics are important, how certain limitations that happen which within the body which are resistant to diet and exercise, how emotionally taxing they are for many people, and I've seen that in my own profession. And just to
yeah.
help the audience, bust a few myths of that, like plastic surgery is not it's not just always all about vanity. Sometimes it's needed for performance. Sometimes it's needed to reduce aches and pains. So I just thought, but before I restart, I just wanted to say that this live is educational, and it is, we're doing this live to just help you all, bust some myths, clarify a few things. In no
Yeah.
way is it a shortcut to living a healthy, good, a
Of course.
nutritionally good life. And in no way am I advocating being a fitness professional. Am I advocating that you guys need to do this? But because I've seen it so much in my profession, which is why we decided to do the live, to bust a few myths. So now you can take the reins.
Yeah, so a lot of people think that cosmetic surgery is a shortcut to fitness. No, it is not. It is a supplement to your fitness regime,
Right.
which we always encourage patients to follow both before and after the surgery. So if they are fit and they have some small issues with resistant fat, we can really sculpt them nicely. And if they're struggling to lose and getting areas which are resistant, we can help them to put them into a positive body image so that then they can resume their
Right.
fitness journey.
So I think the first question that, before you ask me questions, I think the first question that I would like to ask you is, as women, especially over the, in the previous years, now we still have become more aware about, what diastasis recti is. For all of you who work out, this, it's now being really talked about, is the abdominal split that happens post pregnancy. A lot of time that split closes on its own, but a lot of times due to faulty training or early training, that separation in your abdominal wall remains. And over a
Yeah.
period of time, I've seen that when trainers are not very qualified to handle this subject, they force their clients to do a lot of abdominal flexion, ab work, which actually makes the separation worse. And over a period of time, women realize that I've lost all my weight, but
Yeah.
why do I have this mommy pouch, or why do I still have that separation? And over a period of time, I've seen it in my own career that I've had two of my clients come friends who've actually gone on to have full blown hernias. So can you talk a
Mm.
little bit about this diastasis recti and how it does require surgical intervention? Forget the
Yeah.
aesthetics part, but it does require surgical intervention in
Yeah.
its, in dysfunctionality.
Yeah. So you see, a woman when they become pregnant, the fetus or the kid is in the uterus, right? And the uterus expands.
Right,
Now, when the uterus expands, the central abdominal muscles, or also called as rectus abdominis, there are two parallel muscles going like this from your
right,
edge of the sternum to your pubic bone. They are straight muscles. Now, there they develop a gap in between. Since there are two, there's not one muscle, there are two muscles, but they're joined in. That
Right.
gap expands. And once this gap expands, it's very difficult to bring them back in unless and until the gap is very less. Okay? So if if it goes really wide, whatever exercise you may do, you may put it like this. It's very difficult to bring them back totally in midline unless there is a small gap. And if they're really wide and they become really flattened out, then you can develop an hernia. The other thing, Sumaya, I'd
Right.
like to tell you, a lot of women, especially in their mid 40s or late 50s, if you can talk to them, and this is a well kept secret, that their abdominal wall becomes so weak that they also have something called as stress urinary incontinence. So if they
Right.
are having
Right.
a laugh or they are having a pressure, there's small amount of urinary leakage happens
Right.
because of the muscular weakness.
I see that
And
a
if you
lot,
have
especially,
that,
when people are jumping and they're performing jumping jacks,
yeah,
people talk to me about it, that they do have
yeah,
developed urinary incontinence. And of course, we teach them how to strengthen the
yeah,
pelvic floor and abdominal
Kegel
wall. But you're
exercises and
right.
all, yeah,
Right. Right.
yeah. So with correction of divarication of recti, their core strengthening comes back, as well as
Right.
their abdominal strength comes back, and this slight amount of stress urinary incontinence can also get corrected. Of
Right.
course, the aesthetic parts also gets taken care of during that time. But this is very important because unless you correct that, they will have a small kind of sponge, or if you see from profile view, there is a small amount of sponge
Right.
which is always there in such patients.
Because two of my clients actually had full-blown diastasis recti, which were resistant to a lot of core training, a lot of intra-abdominal training that we were doing, because we are qualified to handle that. But eventually, they went on to have their hernia, their diastasis recti repaired. And obviously,
Yeah,
in that came a little bit of cosmetic benefit. They removed their
yeah,
stretch marks, because a lot of women now
of
are very
course.
conscious. They're putting in the hard work. But I could see an improved performance. Like when they came back to the gym, they were able to engage their core a lot better. They were able to do a lot of their functional movements a lot better, because that surgery did help
See,
them
the
a lot.
muscle is restored to a place where it should have been. So once
Right.
you restore the anatomy, of course, your core strengthening and the muscular ability becomes much more better. And of course, the aesthetic benefit it gives is something which is unmatchable in any case.
I know, especially with stretch marks. I saw her, my friend who basically got her, and which is why actually I agreed to do this live with you, because I've seen such a benefit with her in terms of her athletic performance when she got it. She's been suffering from it for
Is she
almost four or
listening to
five
this?
years. I don't know
Is
whether
she
she's
listening to
listening to it.
this?
I don't know about that, but it was something that she was struggling with for a while, and not aesthetics was actually not really her main reason for doing it. But she had a
Yeah,
full blown diastasis recti, and when I saw her back in the gym, she was doing really well in terms of performance. And with
yeah.
that, of course, comes a lot of aesthetic benefit of getting rid of stretch marks and improving
So
your
you see,
confidence.
stretch marks, we do, the stretch mark, because we remove that excess skin, so the stretch marks in those skin goes. We also do waist contouring. If you have seen our feed, we post a lot of our before and after pictures. We give you a really nice hourglass shape. The scar is kept very low. And what
Right.
we also do is a high definition tummy tuck in which we create those contours, that inviolable contours, you see, which is called as a champagne groove in the midline, the edges of rectus muscle. This looks very athletic and fit. So not that these patients are not going to gym and doing exercises and they can't make it. But
Right.
once we are doing it, we just do a bit of a sculpting, which gives them a
Right.
wow look.
I want to also ask you one important question is, I see that a lot again in the gym, women who are heavy breasted. And again, guys, I'm honestly doing this live just to educate you. People do not openly talk about this. And I just want to do this so that somebody comes out and talks about it, so that it's an open platform for conversation. I've seen a lot of women who are heavy breasted, who are constantly struggling with cervical issues and postural issues because of them being hunched forward to hide their heavy breast. I actually trained one such client who had actually got a breast reduction. She was a young girl. She was in 23, 24. She had got a breast reduction surgery from the US, and she had come to, after that, to come and train with us. And I actually saw the journey with her, her return of her confidence, again, return of just proper alignment of the body, because mostly people are...
You, yeah, you don't sit like this. They stand
Right,
like this, right?
right,
Because they're hunched back because of the weight. Imagine living your life with 2 to 3 kilos extra on your shoulders daily. It
right.
is a struggle.
So my question to you is, I don't know if anybody will ask you this, are these, especially say, which are more women centric, like a hernia repair, anything to remove stretch marks, let's say a breast reduction, are these, a lot of people don't do it because they're very scared that the process is extremely invasive, the recovery is extremely long. Please be honest about it. Is it painful? Is it extremely long? I mean, how is the recovery? How soon do you go back into training, etc.?
So, first of all, a lot of people do it. They get it done. They may not talk to it in your parties or when they meet you. I do something around 15 to 20 breast surgeries every month. So I think that's a very good number, probably the largest number in the country. So they do it. The awareness is improving. Of course, there are a lot of myths. One myth is that a young woman, if they do it, they don't. They may have issues with their pregnancies or breastfeeding, so they don't. They can easily do it if the technique chosen is right. So when we do a breast reduction surgery, we take off the load. It's typically a pain-free surgery the way we do it, Sumaya, and I'm being pretty honest about it. Patients just feel a tightness kind of discomfort because the breast is reshaped and lifted up and tightened. But it's no pain. In fact, they are discharged the same day, evening. There is no bed rest needed. From next day, they are up and about. Only two precautions we tell them: avoid heavy weightlifting exercises over your shoulders for 6 weeks and wear a sports bra for 6 weeks. That's it. Basic antibiotic analgesics for first 7 days. Nothing else. It's one of the most rewarding surgery we do in our practice. I have had patients who have had...
I believe it's a life-changing surgery in terms of for people who actually struggle with heavy breasts. Like I said, I've trained 2 women who've had it done, and the
largest breast reduction I've done is more than 2.2 kgs each side. So 2.2 kgs, 2.2 kgs each side. We have submitted it from Limca Book of Records, probably the largest in the country ever done. And even if you see, and her pictures is there in my feed, we don't only reduce them, we also make them beautiful. And this is very important because someone who has a huge, heavy breast and sagging, they have not appreciated the beauty of the breast. And it does not only impact their day-to-day with the weight on the shoulders, but it also impacts their interpersonal relationship and their self-confidence, which totally skyrockets after the surgery is done.
So another one that I want to talk to you about again, which I see a lot in the gym, is male breast, gynecomastia. And I know, again, guys, I'm all for training. I train. Again, I'm doing this live just to help you guys, reach out to a very well-renowned surgeon who can answer questions. So coming back to this, I've seen a lot of boys, especially, who suffer with gynecomastia. And no matter how much training and no matter how much pec development we do, pectoral exercises, the typical shape doesn't change. Of course, you get the muscle definition, but the bulkiness of the breast tissue stays. And men don't want to talk about it, and we talk about it, saying that look, it's gynecomastia. Maybe you'd want to. Men don't know that they also have hormonal issues that they need to understand.
No. In fact, it may be surprising to you. Gynecomastia surgery is the most common cosmetic surgery done in this country.
Really?
Of course, after hair transplant. Yeah, gynecomastia is a huge number. We do something around 30 to 35 gynecomastia surgeries every month. Today, I did 2 gynecomastia surgeries and one was a redo surgery.
So tell me again, is gynecomastia definitely resistant to exercise? Does the shape even become better no amount of training, or you can make it better and then you still have a little bit of it left, or depends on the degree of it?
Yeah, of course, the shape can get better. Now, understand, when you are shaping up and you are losing weight or shaping a muscle, what's happening? You're losing fat. You're using the cell size of the fat cells and you're shaping up muscles, your pectoral muscles. So you'll have a nice shape. You can have a good trapeze and good pectoral muscles. But your gland, if it is formed, will be there. Now, this gland most commonly gets formed in adolescent. Everybody has hormonal changes at that time, or due to some steroids, medicines, they may have some glandular tissue which gets formed. Now, if there is a glandular tissue which gets formed, it cannot be treated by any medicine, drugs, exercise, period. It has to be surgically removed. And once removed, it's a permanent cure unless and until they take some steroids or some other medicines, hormonal issues they may have. Otherwise, it's a permanent cure. It can never happen again. And once we remove the gland, the underlying shape gets reflected so nicely. Because think of it like there's a layer of breast tissue over the pec muscle. Once we remove that, whatever changes you do in your pec muscle in your training gets reflected in your chest very nicely.
Right. I don't know whether when we announced this live, whether you got any questions, but I definitely got questions. One of the questions that I'm actually going to ask is that typically when somebody, again, mostly women-centric, when someone is trying to lose weight, they still have stubborn pockets of fat. The question is that, do you need to lose your weight and become the closest to your BMI? Say, for example, outer thigh. A lot of women in my gym, it's a very Indian body, struggle with very
Saddlebags. We
defined,
call them saddlebags.
which are really actually at some point resistant to exercise, because वो कभी अच्छा हो जाता है, कभी बुरा हो जाता है. It depends which, even if you put on 1 kilo, it shows on them. Even if they lose that 1 kilo, it shows on them. So firstly, why does that happen? Why does the body store fat in one particular reason? And B, why is it resistant to exercise? And C, is the surgery, again, is it something which is quick? Is it painful?
Okay, so first part, why are they like that? It's genetic. Everybody will have different areas of fat cells distributed different proportions at certain areas. Right. God did not make everyone proportionate. So they are blessed with some excess fat cells at certain areas. They may blessed with certain less fat cells at certain areas. So at that particular area, they have more fat cells, and every one of us have resistant areas of fat. Some may have love handles, lower backs, inner thighs. They may not have thigh gaps, outer thighs.
By resistance, what do you mean? Like, no matter how much exercise you do?
When they do exercises, they start losing from everywhere. They start losing weight from their face. Their face starts sagging, but the saddlebags don't
lose place. Yeah. By the way, I see that a lot. A lot of people say that if I try to lose weight and they really change, and which is why, again, I wanted to do this, right? Because a lot of times I feel that men and women who are actually more active are the ones who are more emotionally disturbed with these resistant pockets of fat, because they are actually killing it in the gym. They're doing everything they can. They're eating right. They're doing everything. And they're the ones who actually constantly, when they stand in front of the mirror, it's emotionally traumatizing them because they are working so hard and they can't lose these stubborn pockets of fat.
So because they see those things, someone who is 200 kgs and is not bothered about their body, they will not see anything. Right. Someone who is bothered and who are killing it in the gym, they are scientifically aware of what they can do. Then they come to us that these are resistant areas of fat and we can't do it. And mind you, let me also make this clear. Liposuction or body contouring is not for 150 kgs or 200 kgs of people. It is a body contouring procedure for someone who is very closer to their ideal body weight. Right. And they are finding it resistant to lose that excess amount of fat or skin, and we do that. That's it. And then we encourage them to go back to the gym. So the second part of your question was, how do we do that? So we do a gentle liposuction. There are different technologies. We combine those technologies so that they also get a skin tightening effect. And depending upon area to area, the pain differs. The extent of fat removal also changes that. So if there is small amount of saddlebags, 400, 300 cc on the outer thigh, can be under local anesthesia, daycare procedure, patient walks back home the same day. Right. However, if someone has inner thigh, someone says first surgeon to say this. No, I think every cosmetic surgeon will say this. Nobody does body contouring or liposuction for someone who for more than 150 kgs, 100 kgs. No. Mega liposuction is a thing of a past. It's not like that. Our idea is patient should come, get the surgery done, go back home the same day with a better shape. Pain is obviously there as discomfort. We try to minimize it by modern technologies, painkillers, analgesia, as well as the way we do this surgery. However, some discomfort is there, but usually it's for a week to 10 days. Please understand there is no gain without pain. Yeah.
That's with exercise also, by the way, till we are in pain we're not in, which is why next question that I got asked was
I also got a question while meanwhile.
Okay, so in the recovery process, people say that, okay, if you take out an X amount of fat from that particular area, and if you tend to put on the 1 or 2 kilos, now your fat comes somewhere else. I know that's not true, because I've also done my research. It's basically your stubborn areas of fat have double the amount of fat cells, and all liposuction you do is just taking that out. So when you put on fat, you evenly distribute it as opposed to just blocking in those stubborn areas. Am I right?
Exactly. So see, fat cells in our body remain constant and we are born to it till we die. They do not multiply. They only increase in size. So someone has 100 fat cells in their tummy and 200 in the thighs. When we remove the fat cells from our thighs, from the 200, we make it like 50 to make them proportionate. But when they gain weight, that 100 fat cells in tummy will increase in proportion. So they think
Right.
that, so some people think that they've done liposuction and they can eat pizzas and biryanis daily. Sorry, no. You have to live a healthy lifestyle. There is no substitute for that. कोई ऐसी सर्जरी नहीं है कि आपने करा लिया और उसके बाद आप हर रोज कुछ भी खाते रहो, ऐसा नहीं है. You have
Right.
to remain fit.
Are you, doc, seeing a lot of are you seeing
Lot
a
of
lot
people
of
saying that
younger,
they're happy with their work.
are you seeing a lot of younger generation, people who are extremely fit, gym goers, actually more knock on your door more now than before in your career?
No, they don't knock on my door. They call the clinic and they take an appointment. But yes, they are coming more often because now they're aware about their bodies. They understand that these procedures are safe.
And we are so influenced by what's happening in the West, right? So many, all the models and all the actresses, they have all, resorting to some kind of cosmetic procedure in spite of actually leading a healthy, active
What's
lifestyle.
wrong with that? Everybody wears nice
By the
clothes.
way, which is why I took this bold step
Why?
to do this live, because
Yeah.
I said, because I feel there's nothing wrong with it. If you work hard and if you're doing everything right, this is a platform for us to openly discuss conversations like this, so that our viewers and our people who are my clients are more aware about it.
Yeah. So see, the idea is everybody wants to look good. You wear good. Why do you get a haircut, a facial, or a
Right.
makeup? They want to look good. If you can look good in your body, which God has given you, why not?
Okay, so my last question, and you can ask me any question, is typically, I had a lot of friends also. This is my question to you. Initially, there was a trend of that, women had their babies and right on the operating table, they did especially that C-sex, they could close their, you can't do that, right? Isn't that?
It is. I've had debates in our national forums for cosmetic plastic surgery. It's a given thing. You should not get it done. As simple as that. I'll tell you some reasons for that.
Reasons why?
One, there is something called as purpurium. 6 months, the skins and the tissues of every patient, every person every female shrinks after the pregnancy. You've had kids. You would notice that your body changes in 6 months' time.
Yes.
So when we do tummy tucks or abdominoplasties or body contouring, everybody knows I do a lot of measurements, I do a lot of markings. You cannot do the measurements right now unless you know what will shrink how. Let that thing shrink and then do it the perfect way. Once you have seen the tissues, get back to their originality and then do it. That's how you can give them a bestest result possible. But sometimes patients are insistent. I tell them, no, I will not do it. The second reason, during a pregnancy, your hormones are on rages. Your progesterone, your estrogen are really high. And that is a vasodilation effect. What does this mean? If you do a surgery, you will have more bleeding. Why do you do that?
Got it.
At that time, you are there for cesarean, get it done, go out. Second, it's a time for a mother to child bonding. Right. Let the person do that. And then this wait and let everything shrink, get back to its original place, and then we'll be there to help you.
Right. And okay, so I have one more question, by the way, which is in terms of the kind of people you see, do you tell someone to, there's a question I'm asking on behalf of a friend. So supposing someone has 15 kilos to lose, but she has a certain area and certain pocket of fat, which is actually resistant at the current stage. Would you actually ask her to lose her 10 kilos and come? Or would you say, okay, let me do that resistant area and that will motivate you to, what's the process?
My first thought process is always that try and lose as much weight as possible. In any ways, in my practice, I have a waiting period for 6 weeks for surgeries. So I give them 6 weeks, you can go ahead and lose weight. And then closer to your ideal weight, it also tells me that this person is motivated to maintain his result. It's like a test. At the same time, I also get some patients that, doc, I'm trying my best, but this one portion puts me totally disheartened. And it totally demotivates me. And at that time, we agree to go in to treat that fat area and put them back into their positive frame of mind. Basically taking them out from the negative vicious cycle to a positive vicious cycle so that they can maintain.
Last question. There's so many
this is the third
non-invasive.
last question.
Tell me last question. There's so many non-invasive, there's so many questions to ask. There's so many non-invasive procedures now out there. So I know for a fact, because I'm in the I get a lot of first dibs to these kind of processes. People invite us to come and see, is like, say, for example, cool sculpting, body excellis. I think there's something called sculpture. So without being absolutely fair, telling us that when do these protocols work, when do they don't work, when is the right time to actually opt for a surgical procedure as opposed to, say, a non-invasive procedure?
Yeah. They all work. Let me be very clear. They all work,
okay.
But they all work to a certain extent.
Right.
Now, when you go to a website of Cool Sculpt, it was originally made by Cool Sculpt, Zeltic, and now bought by Allergan, which is now AbbVie. They always advocated small pockets of fat, like small double chin, small love handles. But what is happening is now that people are using and selling them left, right, and center for someone who is much more than that. Right. And that is not right. That's my submission. It works, but it works in a right indication in selected individuals.
Got it.
Okay. Same is for Exilis. It's a radio frequency skin tightening. It works, but to a certain amount of tightening in a slight skin laxity. But if someone has a total lax skin in their face or tummy, then they need that much amount of skin removal. So science you have to understand the science, what each procedure can do. They all work, but they all have their own indications.
Got it. So these were my questions. These are the questions that I wanted to ask, and these are the questions that were sent to me.
I have no questions. I got only one question in my DM to be asked by you. They wanted to know, what is Miss Sumaya's age?
My age? My age is for you to guess, but let me say that I have good genes. My mom is very young looking, so I am in my 40s, and proudly so. And I think that goes just by the mere virtue of living a healthy life and eating well, eating good food, and relying on my genetics.
Exactly. So eating good food, watching what you're eating, as well as fitness makes a huge difference on the way you look. And this is me, plastic surgeon, which people think that we all say that we will do everything by surgery. No, nothing can replace fitness. You have to maintain a good fitness regime and a healthy lifestyle.
That's why I was asking you that. Are you seeing actually more fit people now knocking at your door to say, okay, I'm really working hard, trying hard. Is there any way you can help?
Yes, emotionally, they are, and we love patients like this because they are a challenge also. You see, we get some patient that we have done everything. I have six-pack abs, but I'm not getting that look of external obliques. You get what I'm saying? Because that flies, excess weight is there. So it's a challenge. It is like nakashi, sculpting of that small things, which actually I love. I love creating a body art. Like, this is what I think.
So guys, this was our live. I don't know if you guys have any questions. Please.
I lost your voice.
Any questions? In case you have any questions that you'd like to ask, please go ahead and ask us and ask him actually. And yeah, that's it. Anything else, Doc? Have I missed anything?
That's it. Looking forward to meet you in person soon. It was lovely. I thoroughly enjoyed this live.
Thank you. Thank you so much. Thank you, guys.
Thank
Please
you.
drop in all your questions on his page. And yeah, we just thought it was an open chat, and I hope you guys enjoyed it.
Yeah. Thank you. Bye-bye.